OK, let's get more now on that dire warning from Gladys Berejiklian that things will only get worse in October in New South Wales's already stressed hospital system. Norman Swan is the presenter of RN's Health Report and the ABC's popular Coronacast. He joins us now from Sydney. Norman, good morning to you.
Hi, Michael.
What's your take on this situation? The Premier is being at least very upfront about what lies ahead for the state's health system.
Yeah, because unless the curve bends, you could see 4,000 cases a day by the end of September, maybe sooner than that. Hopefully I'm wrong. The predictors are wrong about that. And it's hard to know. As vaccination rates go up, the hospitalisation rate amongst will go down because you've got a higher proportion of the population vaccinated. But it's possibly between around about 5% of whatever number that is on a daily basis, with a delay of maybe 10, 12 days, will end up in hospital. So if it's 4,000 a day, it's 400. And 1 in 50 of cases, not of those in hospital, but 1 in 50 could end up in ICU. So that ends up being a lot of people. And it accumulates because these are not people who go into an ICU and are out in 2 or 3 days. These are people who go into an ICU and they're in that bed for 2 or 3 weeks. So there isn't a sense of turnover. It's cumulative, and it will grow. The capacity is there in the system for that number of cases, almost certainly. The problem is staff. And if you get an outbreak of COVID in a hospital, particularly in an ICU, and you've got large numbers of people furloughed, you can see what happened at the Royal Melbourne last week or the week before. You can really get a hospital disabled by the number of people on furlough. So it's on a knife edge.
And that's why we're hearing the predictions of it peaking in October, because of that build-up and the lag and having people with the extended stays.
Yeah, because even when you get to high vaccination, you're absolutely right, Lisa. As you get to that high level, you've still got this overhang of people who've got the cases who are going to develop serious illness.
Now, we are reporting, sadly, the first confirmed case of a COVID death in the Indigenous Australian community. Some evidence has also emerged, Norman, of the federal government ignoring warnings about the possible impact of COVID on Indigenous communities.
Look, this was front and centre last year amongst Aboriginal communities. They were communicating with the federal government. It's just unclear why we haven't had a coherent and really very strongly directed response at Aboriginal communities. It's probably happened some places and not others, and it's just very hard to get through to what has happened here. But there's clearly been a failure. It's easy to blame vaccine hesitancy amongst Aboriginal communities, but Aboriginal communities are a bit like a general community. There are hesitant people and there are people willing to bear their arms, and it's getting vaccines in there, and I think we've just become distracted, out of sight, out of mind.
Yeah, although there are many differences as well with those communities, and we're going to be talking to Linda Burney a little bit later, just as far as the housing, the ability to isolate and the healthcare that's around. Can we have a look at Victoria? Go on.
Just one quick thing there. I mean, states outside New South Wales and Victoria should see this as a wake-up sign, a wake-up call to make sure their Aboriginal communities are immunised, and they're upping the ante on those and really getting out into Aboriginal communities so that they're ahead of the game, and just really see that as a warning sign.
Yeah, good point, Norman. Brett Sutton yesterday in Victoria seemed to be sounding a little bit more hopeful, but we were remarking that that was sort of the sense that we got last week as well.
Yeah, there are just too many unknowns in Victoria at the moment in terms of chains of transmission, new clusters. This virus is different. Tonight on 7:30, we're trying to explore why lockdowns don't seem to be working as well as they used to. You can blame lack of adherence a little bit. There's a little bit less adherence in Victoria than New South Wales, but there's not a big difference. But it's happening in New Zealand as well. So this virus is just a really pernicious virus. More people are passing it on in a shorter time frame, and it's more contagious, and to more people. It's just a really difficult virus to pin down. And what we're doing is chasing an exponential growth. It's probably not exponential anymore in Victoria, which is great news. But in New South Wales, you're chasing exponential growth with a slower growth in vaccinations. It's great, the growth in vaccinations, but it's not catching up yet with the curve of the virus.
I just want to ask you, I want to talk about kids before we finish. The New South Wales Premier keeps telling us not to, in her words, get caught up in the emotional roller coaster of the daily and increasing case numbers, focus more on vaccination, which is great. We need to focus on vaccination numbers. What do you make of the language there, though? Because it's hard for people not to get really concerned, even possibly distressed by 1,000+ cases each day in a state like New South Wales.
Well, the number of cases a day is really important because hospitalisations, ICU admissions, and indeed deaths track that curve. It's tracking that curve in Israel. It's tracking that curve in the United States. So you can stop talking about the number of cases a day and talk about hospitalizations, that's fine, but that's where the hospitalizations come from. And what parents are worried about is you're getting, it's moving into younger groups. But as it gets into really young kids, they tend to get very mild disease. It's very unusual for them to get severe disease. But when you get to very large numbers, you will get some kids who are getting sick about this, which is why you've got to keep the overall numbers as low as you possibly can, so the burden on younger children is as low as it possibly can be.
Makes sense. Norman Swan, thanks for joining us.
My pleasure, as always.